I'm worried a vaccine that can prevent cancer is on the chopping block. Let's talk about it. The CDC's vaccine committee is set to meet at the end of June to discuss updates on vaccines like flu, COVID-19, RSV, HPV, and meningococcal. Normally this wouldn't be big news, but RFK Jr. recently fired all 17 committee members and appointed 8 new ones, many of whom lack relevant experience in pediatrics or infectious disease. Based on their history of vaccine skepticism, there's growing concern that evidence-based recommendations could be undermined. I'm personally nervous about the HPV vaccine because of RFK's own beliefs that could now go unchecked. Hey, I'm Dr. Katie, a family medicine physician in training with a background in molecular biology and public health. So yes, I care very deeply about vaccines. And today I want to talk about one of my favorites, the HPV vaccine. HPV stands for human papillomavirus. It's the most common sexually transmitted infection in the US, where nearly 85% of sexually active people will be infected at some point. While most cases are asymptomatic and clear on their own, certain strains, especially 16 and 18, can cause cancer. HPV causes cervical, anal, and penile cancers, as well as head and neck cancers. In fact, HPV-related throat cancers are now more common in men than cervical cancer is in women. That's why the vaccine is recommended for everyone. The HPV vaccine, first announced in 2006, targets the most dangerous strains. It's given starting at age 11, with 2 doses if started before 15 and 3 if started later. Since its rollout, it's reduced rates of HPV infections by 88% among teen girls and 81% among young women. Countries with high vaccination rates like Australia are on track to eliminate cervical cancer as a public health issue. I used to work in a pediatric clinic where we offered it to all preteens and teens. Some parents would decline, saying my child isn't sexually active, but HPV can lie dormant for years and the vaccine works best before exposure. I'll literally never forget a call from a previous patient in her 20s who asked if she'd completed her HPV series. When I told her she had, she let out the hugest sigh of relief. "Oh my God, thank God," hung up the phone. You just don't get peace of mind like that. RFK Jr. has been an active opponent of the HPV vaccine. During his confirmation hearing, he called it dangerous and defective and falsely claimed it could increase the risk of cervical cancer, a claim that's completely unfounded and has been rejected by every major medical authority. The truth? This vaccine has been extensively studied and is proven to prevent cancer, not cause it. The bottom line, HPV vaccine is safe, effective, and protects people of all genders from life-threatening diseases. It doesn't just save lives, it provides real peace of mind. So if you believe in evidence-based medicine, now's the time to speak up, whether that's scheduling a vaccine, talking to your friends or family, or calling out misinformation when you see it.